Imagine you're on a journey through a complex, winding maze of roads. Some of these roads might be blocked or damaged, but you can't tell just by looking from the outside. Now, picture that instead of roads, these are your blood vessels, and this journey is happening inside your own brain. How can doctors navigate this maze to spot hidden issues like a brain aneurysm before it's too late? That's where the angiogram comes in. This incredible test gives doctors a clear map of your blood vessels so they can pinpoint any potential problems. Let's explore how it works, why it's so valuable, and what you need to know if you or a loved one is preparing for one. What is an angiogram, and why is it important? An angiogram, or cerebral angiography, is a specialized test that uses X-rays and a contrast dye to reveal the intricate network of blood vessels in the body, particularly in the brain. For those at risk of a brain aneurysm, this test can be life-saving. By showing the exact location, size, and shape of an aneurysm, an angiogram provides a roadmap for doctors to diagnose and treat the condition before it becomes a serious problem. So why does this matter? Aneurysms can be silent and symptomless, often lurking undetected until they rupture, which can lead to stroke or even death. The angiogram is one of the most effective ways to diagnose a brain aneurysm before it becomes dangerous. If you're considering this test or have a loved one who is, understanding the process can help make the experience less daunting and more manageable. Preparing for an angiogram. Knowing what to expect can help ease any concerns about the procedure. Here's a simple breakdown of the preparation steps you'll need to follow. 1. Medical review. Your doctor will start by reviewing your medical history and performing a physical exam. This helps them assess your overall health and determine if you're a good candidate for the test. 2. Fasting. You'll likely be asked to avoid eating or drinking for 6-8 hours before the procedure. This step minimizes potential complications during the test. 3. Medications. Your doctor might advise you to temporarily stop certain medications, especially blood thinners, a few days before the procedure. These medications can increase the risk of bleeding. 4. Pregnancy precautions. If you're pregnant, make sure to let your healthcare team know. Radiation is generally avoided during pregnancy, so they may take extra precautions or suggest alternative tests. 5. Nursing considerations. If you're breastfeeding, your doctor might recommend pumping and storing milk before the angiogram. The contrast dye used in the procedure can take around 24 hours to clear from your body, so it's a good idea to have some milk set aside for that period. These steps ensure your safety and allow the doctors to focus on getting accurate, clear images. Step by step, what happens during an angiogram? The procedure itself is carefully designed to be as safe and comfortable as possible. Here's what you can expect from start to finish. 1. Local anesthesia. The healthcare professional will numb the area where the catheter will be inserted. This is usually in the groin or arm, and the numbing helps to minimize any pain or discomfort. 2. Catheter insertion. Using X-ray guidance, the doctor inserts a thin, flexible catheter through a small incision. They then carefully guide it through your blood vessels until it reaches the brain. 3. Contrast dye injection. Once the catheter is in place, a special dye is injected. This dye travels through your blood vessels, highlighting any blockages, aneurysms, or abnormalities. The dye may cause a warm sensation or a metallic taste in your mouth, which is perfectly normal and usually goes away quickly. 4. Imaging. As the dye moves through your blood vessels, the doctor takes X-rays to capture detailed images. In some cases, additional imaging techniques like CT or MRI scans may be used to get an even closer look. 5. Catheter removal. After the procedure is finished, the doctor removes the catheter and applies pressure to the insertion site to stop any bleeding. Stitches usually aren't necessary. Is it painful? What to expect during and after the procedure? While an angiogram might sound intimidating, it's generally painless. You may feel a small pinch as the local anesthetic is administered, and perhaps some pressure when the catheter is inserted. Some people describe a warm or flushing sensation when the dye is injected, and a few may even notice a metallic taste or mild nausea. These sensations are typically brief and not cause for concern. Once the procedure is complete, you'll need to avoid strenuous activities and heavy lifting for a few days. Mild soreness or bruising at the insertion site is common, and over-the-counter pain relievers like acetaminophen or ibuprofen can help. Most people can get back to their usual routine within 8 to 12 hours, but be sure to follow your doctor's specific recovery instructions. Potential risks and side effects. As with any medical procedure, there are some risks to consider, though they are generally low with angiograms. Minor issues might include a skin infection at the insertion site or a mild reaction to the contrast dye, which could cause an itchy rash. These are typically manageable with medication. More serious risks, though rare, can include kidney damage, stroke, heart attack, blood vessel damage, or an allergic reaction to the dye. It's also possible, though uncommon, for the procedure to lead to a life-threatening condition like a brain bleed. It's essential to discuss these risks with your doctor, so you feel informed and prepared. When to seek help after an angiogram. After the procedure, it's essential to monitor your health closely. Contact your doctor immediately if you experience any of these symptoms. Uncontrolled bleeding. If bleeding at the insertion site doesn't stop or worsens, seek help. Pain or swelling. Persistent or worsening pain or swelling at the incision site is also a red flag. Infection signs. Watch for fever, chills, or unusual drainage from the insertion site. Chest pain or difficulty breathing. These could be signs of a severe reaction or complication. Numbness or tingling. If you feel numbness, weakness, or tingling in any part of your body, it's essential to get it checked. Headache or dizziness. These can indicate more serious issues, especially if they are severe or sudden. Changes in vision or speech. These symptoms can point to a serious complication, so don't ignore them. If anything feels off, it's always better to be safe and reach out to a healthcare professional. Understanding your results. After an angiogram, a radiologist will review the images to check for any signs of abnormalities. If a brain aneurysm is found, the test will provide information on its size, shape, and location. This detailed information helps your doctor determine the best treatment options, which may range from medications to surgery, depending on your unique situation. A normal angiogram means the blood vessels appear healthy, with no signs of blockage or aneurysms. However, a normal result doesn't necessarily rule out other health conditions, so your doctor might recommend additional tests if you're experiencing ongoing symptoms. Final thoughts? An angiogram is a powerful tool for mapping the blood vessels in your brain and diagnosing potential issues before they become life-threatening. By understanding the procedure and knowing what to expect, you can approach it with confidence and peace of mind. Remember, your health journey is yours alone, and it's essential to stay informed and proactive. If you or someone you know is facing the possibility of a brain aneurysm, an angiogram can provide answers and, ultimately, peace of mind.